afternoon. First off, I'd like for you to think of 5 females in your life. It could be your mother, your sister, your aunt, your best friend, or possibly even yourself. According to statistics from the Mayo Clinic in Rochester, Minnesota, one of these 5 women will suffer from a form of postpartum depression or postpartum anxiety. Postpartum depression or postpartum anxiety is a serious disease that affects both mother and child, but it doesn't have to. Today I'm going to give you the warning signs of postpartum depression, or PPA or PPD, how to help an individual suffering, and treatment options available to those who are currently suffering. The birth of your child should bring a new mother nothing but pure joy, bliss, and internal feelings that cannot be described as anything less than pure happiness. However, PPD and PPA can steal these fleeting moments of joy and bring nothing but anxiety, guilt, or even numbness in the first few minutes the mother meets her child. The Mayo Clinic in Rochester describes postpartum depression as the transition following the birth of your child. New mothers will experience a range of emotions, and some might be surprising to hear. Mostly a shift in moods, and it could be either anger or irritability, constant anxiety and worrying, feeling overwhelmed, lonely, or even possibly numb. You have trouble sleeping, either you do too much or too little, disconnecting from life, or even sadly your own child. And lastly, most severely, is self-harm to yourself or harm to your child. New mothers with certain past or behavioral or emotions during pregnancy have a higher risk from suffering postpartum depression or postpartum anxiety. According to the National Institute of Mental Health, symptoms of depression during or after a previous pregnancy have dealt with depression or bipolar disorder at another time in her life. A family member was diagnosed with postpartum anxiety or postpartum depression. A stressful life event or change during pregnancy, such as the loss of job, death, domestic violence, etc., a lack of emotional or support during pregnancy, and or gestational diabetes may increase the risk for you to have postpartum anxiety or depression. Postpartum depression or postpartum anxiety is a serious medical condition. However, if caught early enough, it is treatable and a mother can begin to experience the joys of motherhood. Sadly, left untreated, postpartum depression or postpartum anxiety can last for weeks, months, or even years. The Office of National Women's Health, a 4-foot fighter of both PPA and PPD, recommends 2 sources of treatment to combat PPD or PPA. According to the office, it is crucial to talk to your doctor, nurse, or even pediatrician if symptoms last longer than 2 weeks. 2 key treatment plans then will be put into action. First is talk therapy or cognitive therapy. Oftentimes, new mothers are ashamed or embarrassed to talk about their new symptoms, and with a professional licensed therapist, they will open up more. Secondly, if severe enough, it could call for the use of medication to bring the levels of hormones down or up to normal standards. The most important and critical point is to let any new mother suffering know that she is not alone, and that there are many loved ones and close friends playing a crucial role in helping a new mother with postpartum depression or postpartum anxiety. There is nothing to be ashamed of. Bonding with your child is every mother's journey, and no 2 stories are the same. One way you can show your support is to first recognize the signs, any of these, in any woman suffering, and to approach them with concern. Number 2 is let the mother suffering know she is not alone, and I cannot tell you enough about that. It has nothing to be ashamed of. Loved ones should be encouraged to take or even the new mother to see a doctor, show support, and encourage the treatment the doctor recommends. Lastly, any help with a new baby is perhaps the greatest support you can give. Help out around the house, do dishes, clean the house, take the baby for the afternoon. Just let the mother practice a little bit of self-care. Postpartum is an illness that does in fact affect many. However, with early detection, treatment, and support, a new mother can overcome her symptoms and move on from beginning her new journey as a mother. Postpartum is more than just the typical baby blues, and many will suffer. It is an illness that should be spoken about, and the stigma behind feeling like a horrible mother because you are suffering needs to be eliminated. I understand and come from a place of suffering from postpartum depression and postpartum anxiety for over 2 years. My name is Emily, and I was 1 in 5. Thank you so much, and have a great afternoon.
Yeah. Good.